I'm Dr. Victoria Reinhartz. I am the Chief Executive Officer of Mobile Health Consultants, and I am a consultant pharmacist for mobile integrated health and community paramedicine teams across the nation who are looking to solve the access to care problem.
All right, great. So this is Dr. Bartu with Pilltalkpodccast. We have another episode, a great episode. We have Dr. Victoria Reinhartz, CEO of Mobile Health Consultants.
Yeah.
She's into mobile integrated healthcare with pharmacists being integrated with paramedics to bring healthcare to underserved communities. So we have a great episode with a lot of information. So make sure you check it out. So Dr. Reinhartz, how are you doing today?
I am doing great. You know, it is a travel week for me, so I'm getting to carve out a couple days to spend some quality time with the kids and do some pool hours and things. I live in sunny Tampa, Florida, so
Nice.
You know, we get to do the pool in April here while it's snowing in other areas. So it's really actually a good week. How about yourself?
Man, it's going well. It's going well. I do wish I was in Tampa to get some of that warmth, because out here in DC, 1 minute is hot, next minute is cold. We're still going through that influx of temperature. So hopefully summer finally hits and we stays in the 80-degree weather.
Oh, I hope so for you. It's really beautiful here. So I'm sorry to rub that in a little bit.
Nah, you're good. So I just want to jump right into it. Because you started off as a pharmacist, can you give us how you got into pharmacy?
Yeah, so this is actually a really fun story. I was in college and I was an accounting major, kind of good at math, kind of good at numbers, and wasn't really passionate about it, but that's what I was doing. And I was waitressing on the weekends to put myself through college. And someone sat in my section in the restaurant who was a pharmacist. And he kind of pulled me aside and said, you know, I've been paying attention to you waitressing here. And I've noticed that you have a really good short-term memory and you can balance the priorities of a lot of different tables at one time and you can communicate with people. And I just think that, you know, you have a lot of potential to go into healthcare. And have you ever thought about being a pharmacist? And at that time, I didn't even know what pharmacists were, what they did. I had, never been exposed to that career as an option. And I went home that night and I called my best friend and I said, you won't believe what this guy said to me today. And she said, oh, well, the pharmacy next door to me is hiring. You should go in there, as kind of a joke. And then I just did. I went in and I said, are you hiring? And they said, yeah, can you start Monday? And that's that. So 4 days later, I'm working my first shift in a pharmacy and I fell in love with it. And I loved the patient care element. And so that's really how, I fell in love with the profession. And then I went to pharmacy school and that's that.
Man, that's great. Something so simple as like a minor conversation turned into like a whole thing that changed your trajectory in life.
Yeah. And, I wish that I could go back and find that individual. I wish I had gotten his name and his information and things so that I could thank him, because he literally changed my life. But I think it goes to show that, as professionals, when you invest in people and you take the time to acknowledge skill sets of people and, you can really pivot and help them to achieve incredible things. And I'm so thankful for that pharmacist who just took 2 minutes to talk to me about that.
Yeah. So just a little off topic, but on topic. So I read a book a month. So for the month of April, I'm reading the book, The Alchemist, right?
Oh.
And that's part of the book, like how in the book it calls omens, but just signs come to you to help you develop and get to your personal legend, like your personal purpose in life. And like that guy was like a sign for you to become who you are today, to lead you into the right direction.
Yeah, absolutely. And now I think you've got me intrigued to read that book. That sounds awesome. I try to read a fair amount myself. I have just finished reading a book called Procrastinate on Purpose. It's by Rory Vaden. And it's essentially this book where he helps to kind of give you permission or help you figure out that it's acceptable to eliminate things off your plate that maybe other people feel are important, but you're recognizing aren't in alignment with your own goals, or really maybe aren't actually important or urgent enough to really need to even get done. And then also figuring out, so of the things that do need to get done, what can I automate? What can I delegate to someone else and support? And finally, if something has to be done by me, does it have to be done right this second, or can I delay that, right? Does it have to be done right now? And so it kind of is permission to procrastinate on purpose and make the best use of the time that you have right now. So it's been a great lesson for me.
Yeah, nice. That kind of reminds me of something I came across in one of my leadership seminars, conferences, and one. It was like a quadrant. It's like what's important, what's urgent, and I think I forgot the other two. It's like what's urgent, okay, but that might not be important, so that can just hold off. What's important might not be urgent, but you need to get it done. So just kind of like figuring out what things need to be and just doing it in the correct order.
Yeah, absolutely. Yeah, it's that classic grid that if something falls into that not urgent and also not important, I might not even need to do that at all, right? So, and I'm sure you can relate. You have so many things going on. You have this podcast, you have your full-time job, you got so much on your plate. You know, there's so many hours in the day. We have to start to be a little bit more selective and figure out how we can automate or delegate or eliminate it if it's not necessary.
True. So you told us how you got into pharmacy and started your career. How did you develop from that point to becoming one of the top 50 most influential leaders in pharmacy?
Doesn't that blows my mind? It just really does. I still can't even believe that happened. I think it was a series of events where I said yes to opportunity. And I really began to dig into my passion. And I think we all have this point, if it never happens and you never feel like I'm doing the wrong thing or I'm not fulfilled, that's great. That means you're on the right path. But I think a lot of us, especially in the healthcare profession right now, are recognizing that maybe we're not doing in my day-to-day work what I feel most passionate about or what is most helpful to the care of my patients. And as more and more healthcare providers struggle with burnout, I think figuring out new opportunities for you to say yes to that help you grow as an individual and help step into you contributing to what you're passionate about and helping that industry or that area or, that aspect of patient care grow. That is really valuable for so many reasons, right? Because it can open different doors and opportunities for you to eventually make a full career shift, which is where I have now found myself. But I think saying yes to new opportunities can also breed a lot of self-content and is good food for the soul, I guess, so to speak. So I was working in a retail setting. So I was a community pharmacist. I was a pharmacy manager for Target, back when Target was Target Pharmacy. Yeah. And I loved it. I loved caring for my patients, but I knew I was probably destined for additional things. So I just started saying yes to opportunities. I started saying yes to becoming a trainer for the district. I said yes to speaking at local events, like for the Rotary Club or for the college, et cetera. And I just started taking chances to learn new skills, develop myself in new ways. And then I was offered a professor role because I had kind of differentiated myself in that sense. And even once I became a faculty member and a professor, I started saying yes to opportunities like, can you come do education on cannabis? I wasn't really an expert in cannabis, but I quickly became one, right? I started to learn a lot about it and said yes to the opportunity. Can you come do some consulting with us for the health department? Or can you help us manage our tuberculosis patients? I said yes to that, even though I wasn't a TB expert, but I developed that skill and that knowledge. And really saying yes to different opportunities is what got me involved in mobile integrated health when I was brought in to, provide some expertise on what medication challenges patients who are frequently calling 911 might have. And that was kind of the birth of how I got involved in mobile integrated health. So, and I don't know, Dr. Barchi, are you super familiar with MIH, or would it be beneficial if I do a quick recap?
Yeah, please give a recap, because I don't think a lot of people have heard about it or really know the impact that it can have. So yeah, please.
Yeah, absolutely. So when I say that I'm an MIH consultant or a community paramedicine consultant, that is an unusual term. So the concept of community paramedicine is basically, identifying the biggest healthcare needs in our communities, right? So we all know that there are communities with poor and underserved populations that don't have access to the healthcare that they need because they're either uninsured or underinsured. They can't navigate the healthcare system because there's a healthcare provider shortage, or because they have dementia or a substance use disorder, or whatever the issue is, right? So they can't access care that they need. They end up calling 911. They use the ER as their primary care. And we know that this results in two things. Number one, rising healthcare costs. The total cost of care per patient will go up. Number two, the actual disease control and health outcomes of that patient is not as good if there's no continuity of care. So what I do is I help to work with teams and local governments and associations and physician groups that want to take a healthcare team and then mobilize it to that community to eliminate all of those access to care issues and actually get that patient the resources that they need so that we can have improved health outcomes and reduction in healthcare costs. So mobile integrated health and community paramedicine are this concept of actually utilizing paramedics, taking them off an ambulance and putting them in an SUV or, another vehicle, and mobilizing them into the community to help identify and resolve these issues. That's community paramedicine. And then mobile integrated health is taking those community paramedics and partnering them with a nurse practitioner, a social worker, a pharmacist, right? Or whatever other healthcare provider is necessary to resolve all of those complex issues that patient has going on.
Nice. All right. So let's just go through this really quick. All right. I'm in the community. I don't have healthcare, or I'm unable to get to healthcare properly. So instead of calling 911, I will give a call to mobile health to get one of the paramedics to come out to see me in their SUV. And they will consult me, give me medications if I need it. And then they will go back to a nurse practitioner, to a pharmacist, and have that person do a follow-up with the patient to make sure that they're taking the medications properly, make sure that they're on the right track to better health.
Yep, you got it. I mean, like, first time, you got it right away. Yeah, and sometimes we even send the NP and the paramedic out together, or an EMT and a nurse practitioner. And sometimes, like when I did our 3-year pilot embedded within a paramedicine program, we actually sent the paramedic and the pharmacist together to the patient's home, so that while the paramedic was assessing the patient's vitals and functional status and all of those things, and doing a home safety assessment, and evaluating the resources and needs from a socioeconomic or social needs standpoint. As the pharmacist, I would be back there reviewing diagnoses, reviewing recent lab work, looking at the meds, doing a med reconciliation, and then providing some counseling to the patient on their medicines, or what we could do right now here today with the medicines that will help to get, this high blood pressure under control, or the blood sugar to a degree that's less dangerous. And so, there's so many different approaches. And now with telehealth, right, you can have a paramedic in the home and just get a provider right on telehealth, or a pharmacist or a social worker, or you name it.
So this is very interesting, and I like it. Because when I was in pharmacy school, I got certified in this thing called MTM, which is medication therapy management. And what you just described when you was with the paramedics was medication therapy management. You would get the med rec from the hospital or from the pharmacy, wherever they go to. You will look into it, make sure there's no interactions, anything like that, and then give the best advice to the nurse practitioner, to the paramedics, to make sure that that person has the best outcome, right? So that's really great, because I know a lot of pharmacists, like we was talking about earlier, feels like they want to practice or doesn't practice at the highest level that they can. And this, when you use the MTM approach, a pharmacist is really practicing at the top of his license. So to back up a little, I know you're MTM certified. So can you tell us, how can a pharmacist be more involved in this and step into this role of being part of the MIH?
Yeah. So and this is where I get really excited, because I have big dreams and big goals. I really believe that every single paramedicine or mobile integrated health team deserves access to a pharmacist. And right now, I am embedded in helping to provide the education and support to MIH teams to figure out operationally how they need to make sure that they're identifying when patients have medication issues. So I think that step one is really ensuring that across the nation, that teams are recognizing how big of an issue the medications really are, right? We know that medical errors and medication errors are top third cause of death, depending on the year that you're looking at it, and in the stats for that year. We know that, somewhere around 50% of the hospital readmissions are due to either non-adherence or an adverse drug event or some sort of drug interaction or something related to the medications, right? So teams are really starting to realize, and physician groups are starting to realize, and health systems are starting to realize, that there is a huge medication component. And, if I can continue to do what I feel is my calling, that, in addition to setting that up as part of the normal standard process for these teams, that we also work to identify the med issues and get those resolved, that I can help to equip every single MIH team across the nation with a pharmacist. And so I have a lot of things in process right now with clients of mine where we're trying to work to establish that network and that capability. And then my hope is in months upcoming that we'll have training courses for pharmacists that can be taken to help position you and set you up for success into stepping into a role like that.
All right. So I think we need to go back a little bit. You told us what MIH is, Mobile Integrated Health. All right. When did you start this business? And then first, I just start there. Like, when did you start the business, and how did you come up with this idea to start it?
I started it as a side hustle. I mean, the truth of it is that I was recognizing that I was doing a fair amount of speaking and a fair amount of, consulting, and that I just probably needed an entity to start documenting that additional income and that there was potential for something in the future, right? And so it kind of just started as a side hustle, and so I founded the business in 2020, and then over the next year, 18 months, I just kind of was doing gig work here and there. And now really over the last, year, the last 6 months, we've really picked up, and now I find myself regularly recruiting, outside consultants or additional pharmacists or other experts to come in and help to provide interprofessional consulting support for people. So it's been great. It's a period of a lot of growth, but again, I knew that this was in my heart to help support this industry, to help support these communities, which I don't care where you're from, that either in your community or near to your community, there are people that cannot access the healthcare system. And it just feels unacceptable to me when we have this solution, which can easily be implemented and can help to resolve that.
Yeah. What's so interesting for me is like, I've never heard it, not never heard, but this is the first that this has come across me, right? Is this something that you're starting out that you want to branch off into other cities and states? Are you looking to do that?
Yeah, so the industry as a whole is growing immensely. When I got involved in the concept of community paramedicine, was with the Manatee County Community Paramedicine, Florida, in the Tampa Bay area. And at that time, I don't know, there were probably like 60 different programs across the whole nation. So very uncommon that this solution had been trialed or piloted. And now there's several hundred, probably 300 or 400, if I had to guess, different types of programs. And they are now being born out of health systems. They're being born out of fire departments, out of local EMS or emergency medical service agencies. They're being born out of physician groups and ACOs, so accountable care organizations, who are recognizing that they have a few patients that are really expensive and they're hard to reach. They don't come in for their appointments, or they have all these socioeconomic issues that prevent them from really having a good handle on control of their diseases. And so these accountable care organizations are recognizing that mobilizing a healthcare team and going to that patient is a really effective way to reach their sickest and most expensive patients. So really, it's an industry that's growing by leaps and bounds. And one of my huge passions and labors of love over the last year and a half or so, we did just write the accreditation standards, so the national accreditation standards for quality and safety and team training for mobile integrated health programs. And that was done through service with CAMTS, which is the Commission on Accreditation for Medical Transport Systems. And so really exciting that now the industry has grown enough that we actually have just developed and ratified as a board the accreditation standards for the industry.
Nice. And I see that you are on the board of directors for the National Association of Mobile Integrated Healthcare Providers.
It is. Isn't that a mouthful? You did really well. You didn't trip up on it or anything. Yeah. So it's NAMIHP, which is NAMIHP is kind of how we say it, because it's way easier than the tongue twister. But yeah, it's the first national association that is advocating for mobile integrated health and the providers of this type of care across the nation. So there's a lot of different agencies, from fire and EMS and hospital, that have dabbled in it, right, and trying to create some framework and support for this model of care. But this is the first national organization to really own this concept and advocate for this concept and provide a network for people wanting to get involved and contribute to this model of care. So if anybody has questions about NAMIHP, or should I try to say it, NAMIHP, feel free to reach out to me. And I don't know if you want to post my LinkedIn in the show notes or anything like that. But connect with me. I'll help get you connected to our executive director. We'd love to have you become a member. There's certainly a lot of growth in the industry, and there's huge opportunity. And I think the same could be said, not only if you're wanting to join NAMIHP, but if you're listening to this and you work for an ACO or you work for a health system and you're like, man, we should do this. We should launch this type of program. Then, reach out to me. I can help.
Yeah. So that leads me to my next question. All right. So let's say you have an aspiring entrepreneur who's in the healthcare field. They come across NAMIHP and they wants to know, how can they get started in this, right? Mm-hmm. So with being on the board of directors, have y'all set up a process and procedures checklist to help people start, or do y'all have anything to help someone start to get into this industry?
Yeah, we actually are putting together entire toolkits of resources that'll be available for members on the website. The other thing is that once you become a member, you get access. So every quarter we do like free webinar type content where you can log on, sit alongside the board of directors, and get to hear the success stories and strategies and tips and points of how do we get this started? How did we launch this program? How do we track our success? What are the mistakes that we made and how did we fix that, right? So we actually have people that are out doing this work that come on and do these lectures. And we also do, we just did a leadership summit, and we also do an annual summit in the fall, where we have, people from all over the nation who have established different types of programs, whether it's health system or EMS based, or, out of a partnership with a physician group. And we have them come and tell their stories and provide a networking opportunity at a live summit. So there's immense value if you're really wanting to get involved in the space. The organization is of immense value. Just the networking alone, to be around and sitting in these rooms with people that are doing this work, amazing.
Yeah. I know, based on the description of it and how you guys are helping people, I know something like this could be very beneficial for the community that I serve, because I work in an underserved area, low income. Most of the people there uses the emergency room as their primary source of seeing a doctor, right? They don't have a primary care. They don't have a dentist. The only time they really see a medical provider regularly is when they come to the pharmacy, right?
Yeah.
And I'm not saying that's a shame, but because they are being able to see someone, and I am able to help them with giving them knowledge, but it only goes so far because I'm unable to prescribe them anything. I'm unable to talk to a provider for them, because their main provider is a hospitalist. And as you know, a hospitalist doesn't see the patients regularly. Like they just see them when he comes in, they do what they can for them, they stabilize them, and they send them back out. So I know things like this will change the outcome of these people's lives that I help.
Well, and I really appreciate you commenting on that, because you're exactly right. Pharmacists are the most accessible healthcare provider, right? And we're also one of the most highly trusted healthcare providers that are available. And yet, you and I both, working in the community setting, have firsthand experience of how you are still so limited in that setting that you can't really prescribe them something unless you have an existing relationship with a physician group. And certainly you can't go home and, identify all the home hazards that are causing them to fall down, or, you can't go home with them and check on their blood pressure or their blood sugars when they're really struggling. And so this accessibility to the patient, there's just so many benefits to it. And if we can couple the concept of pharmacists being the most accessible healthcare provider with the accessibility that mobile integrated healthcare provides, then it really is, a perfect solution. And I do believe that again, it goes back to a lot of the medication issues that these patient populations have, and really how much benefit there is to that partnership.
Yes. That's great. So when you have this in the different communities that they are in, how do patients actually are able to reach out to you guys to get help?
Good question. So the beauty of it is that it can really be structured or set up anyway. So definitely a lot of the most successful programs have some connection to the 911 call system, so that patients who are frequently calling 911 can be kind of identified as, hey, this patient has called for shortness of breath 4 times this month. Maybe they would benefit from somebody going out and assessing what is the challenge, right? Is it that they don't have the medicine they need? They can't afford their inhaler. They don't have access to the pharmacy or transportation to get to the pharmacy to pick up their inhaler. Or is it that they got their power cut off and so they can't run their nebulizer machine? Or is it that they're living in a moldy environment where now the mold has, triggered multiple COPD exacerbations? Or is it not really COPD at all, and maybe they're having panic attacks and that's why they're short of breath, right? Or what is it, either medical or disease or socioeconomic, that is causing them to call 911? So I guess the root of your question, I get excited when I talk about it all the
way. No problem. I like it. We love the energy.
But your question was, how do they get referred into the programs, or how do the patients access this? So the point I'm trying to make here is connecting through the 911 call system is beneficial for identifying patients in need. Additionally, having a partnership with the local health system so that case management at the health system can refer patients out, even with local providers. So physicians should have the capability in any community to say, this patient's in my office, they have ABC insurance issues, or they don't have the support they need at home, or they're underemployed, or whatever that is. And I think that they would benefit from a visit by the paramedicine team to help navigate some of these social challenges, to work right alongside our case management, resources. And so physicians should have the capability to refer in. So I think that's the beauty also, is that these teams are capable of being adapted and operationally structured to meet the population that's in highest need and make sure that they get access to that care.
All right. Man, I got so many questions. I'm thinking of them.
I know, you might have to have me back. I don't know. And as you can tell, I could talk about it forever. So.
Oh yeah. We might have to do like a YouTube live, and that way we can actually get people to ask their own questions about it some more. But my next question, because you're out serving the underserved community, which will be low income, things of that nature, and they might have a question like, how can they pay for this service? Because if they, like you said, they might not have power in the house to run the nebulizer machine, so they might not be able to afford the electric bill. They might not be able to afford going to the doctors. That's why they might not have a doctor. That could be that barrier. And how can they afford this, or what's their way of paying for these type of services?
Mm-hmm. Yeah. So the key to funding in any community is figuring out who these patients are costing money. Right? I mean, I shouldn't be that blunt about it, but that's the way the world works, right?
Yeah.
So you're right. Patients, for the most part, are not going to be able to afford this service. I mean, there is the capability of setting up a concierge model. So if there's any concierge physicians or anything like that listening, that's certainly able to be explored and done. But the patients typically are not able to afford it. And so you have to figure out, how do I fund it? And you figure out how you fund it based on, who's suffering the most from these patients not getting the care that they need. So, obviously there is potential of health system funding. So if the uninsured patients are coming into the ER over and over, never paying their bills, they're eating that money, right? Readmission rates sometimes can fund if a patient is or if a health system is really struggling with readmission rates, but that is probably a short-term option and is probably not the best approach. There is probably the most success in either physician groups or payers who are ending up really their profits are impacted, right? So, and I'm trying to figure out the way to say this in the most politically correct way. But if we have a patient that is costing Medicaid or Medicare, $100,000 a year because they've been hospitalized 4 times this year, if we can fix that, then that payer, Medicaid, Medicare, Blue Cross, you name it, has a lot to gain from a profit standpoint. And so a lot of times we find that the most impactful way is to actually have the payers or the physician groups fund the program.
Okay. So I get what you're saying. Just to break it down in layman's terms, you will work with the insurance companies, the Medicaid, the Medicare, the Blue Cross Blue Shield, CVS, Caremark, and say, hey, I see that with this demographic of people, you are spending 2 to 3 times more than you would with this demographic. I have a service that if we come into these communities, we can reduce your costs by that amount if you fund these programs. And obviously, it's a win-win for everyone. They win by not having to spend excessively on per patient. You win by being able to go out into the communities, and the patients win by being able to get the services that they actually need.
Yeah, it's kind of a beautiful setup, right?
Yeah, it's amazing.
Yeah, so it's figuring out how to get to, get to the table with these groups, and the funding is often one of the hardest parts, right? Is figuring out, who's going to fund it, which population are you going to target, how do we evaluate whether the program is effective, all of that, and then what processes are we going to actually set up as the intervention in somewhat of a consistent manner, right? That can actually reduce costs in the long term. And so I think that's kind of my zone of expertise, right? Is so now we're funded. So like now how do we do it, right? And so I kind of say that, I'm a mobile integrated health consultant, but that operational strategy and the training and education of the team so that we can deploy them and then they know what to do is my zone of expert.
Nice. I feel like we could talk about this all day because I can keep digging into it. It's so interesting because, like you said, just finding different ways to actually like work at the top of your license as a pharmacist. Like what you're doing is that, right? You're putting us in a position where we can actually do those MTMs. We can go out because as a retail pharmacist, our main thing is really wanting to connect with our patients. And we don't have the time to fully connect with them at the pharmacy because metrics, you want to make sure that you meet metrics with getting patients and prescriptions in and out as quickly as possible. And this right here gives the pharmacist time to actually sit down and figure out the patient, which will help them with their health, which will help with the metrics, which will help, as that goes down, that snowballs in. But yeah, this is really good.
Well, thank you. It's certainly something I'm passionate about. And again, it started in saying yes to opportunities. And then, finally I said, enough is enough. I I feel a calling to do this. I know that, and I've seen it firsthand, that when we mobilize these teams, the health outcomes that are achieved and the access to care impact that we have for these patients is just phenomenal. And so, that was that. And I'm in it, man. I devote every day to it. And it's been a really wonderful experience. I'm fortunate to be able to help represent the pharmacy profession within MIH and continue to advocate for further interprofessional care.
Nice. So I've got a couple more questions.
Mm-hmm.
As being an entrepreneur, right? What do you think are some of the challenges of being an entrepreneur with starting this field as it expands and grows?
I think that not even relevant necessarily to MIH, but anybody that is going to become an entrepreneur, it's just way harder, man. It's way harder than anybody. I mean, now I think with startup mentality, and think people have a better awareness of how hard it is, but it's hard in the sense of vulnerability. And, as a woman, that people can interpret that however you want, but it's not because I'm a woman and I'm sensitive or anything like that. There's just so much vulnerability in general if you're going to be an entrepreneur in any industry. There's, financial risk. There is the vulnerability that you have to literally put yourself out there. You have to do things like this, right? You have to do podcast interviews and write articles and step up and join organizations that are doing the change and get involved and go to conferences. And there's a lot of vulnerability with putting yourself out there like that people don't always love to do. There's vulnerability in the sense that you are going to fail. You're going to fail a lot. And I don't know how you are as a pharmacist, but a lot of pharmacists don't like to fail, right? Yeah, a lot of really capable, intelligent, driven professionals don't like to fail. And you are going to fail. If you are an entrepreneur, you are going to fail. For every yes you have, you're going to have 10 no's. For every step forward you have, it's going to feel like you took 2 steps backwards, right? Getting there. You have to learn how to fail forward and fail quickly, and use it as kind of a stepping stone into your next success. And there's vulnerability in that. And you also have to be really self-aware. You have to recognize, I am not doing this right. I'm not doing this effectively. I have to pivot and switch it up, or hire somebody else to do it, or, figure out a different strategy to help ensure it gets done. So, all of those different areas, there's vulnerability with that. And so you got to get comfortable.
Nice. I understand that. Definitely being an entrepreneur myself, with the failing forward, because a lot of times things just doesn't work out the way that you imagine it. But if you keep pushing forward, it will work out in one way, form, or fashion to get you to the next step, to keep pushing forward.
Yeah. You gotta kind of be like Scrappy, right?
Yeah.
I don't know. I don't know if you know Jamie Wilkie. Jamie Wilkie is, she's another entrepreneur in the pharmacy space. Her focus is pharmacogenomics and helping pharmacists start their own pharmacogenomics consulting work. But, she had mentioned that one day. She said, you got to learn to be scrappy. And I just relate to that so much, because you can't give up. And you have to figure out a way to have the grit and determination to continue to show up every day, even if yesterday wasn't a very good day.
Yeah, definitely. Mm-hmm. So leading into that, what do you think are some keys or some character traits that can lead you to success?
I guess for me, the biggest concept I'm focusing on lately is progress over perfection. Nice. I tend to want to do everything perfectly and have like all my ducks in a row and all my T's crossed. And I think as pharmacists, we're driven to that super detail oriented care and strategy, because if we don't make sure all of our ducks in a row, people get hurt, right? But in the field of entrepreneurship, you really do have to embrace progress over perfection, because you can get into decision paralysis really quickly. Yeah. And the last thing you want is to stay stationary. You want to continue to move forward. So yeah, embracing progress over perfection has and continues to be every day, a strategy that I aim to implement.
Nice. So as we wrap this up, is there any words of wisdom or philosophy you like to share with everyone that's listening?
I think that, the number one quote or mantra that I say literally every day is from Desmond Tutu. And I don't know if if the audience knows who Desmond Tutu is, but he's from South Africa. He's a human rights activist. He recently passed away, but he is a Nobel Peace Prize winner and was basically instrumental in South Africa for helping achieve human rights and ending apartheid. And he just is such an inspiration to me, because I can't imagine the undertaking that was. And while in no way I compare my own journey and what I'm doing to the magnitude and the value of what he did, he had a quote, which is, "How do you eat an elephant?" Have you heard this? Yeah. How do you eat an elephant? And the answer is one bite at a time. And I feel that way all the time. I feel like there's so much to do, and there's so many different projects that I'm working on at any given time, and so many different hats that I wear, from entrepreneur and mom to these two crazy munchkins here, and a pharmacist, and a consultant, and board service, and travel, and all of these different things, right? We all have all these different demands. And within the realm of advocating for MIH and, feeling a personal calling and responsibility to help all of these, millions of people across the United States who don't have access to the care that they need, it can feel overwhelming or daunting to manage and do all of this at one time. But I just focus on that. I focus on, okay, how do I eat an elephant? I'm doing it one bite at a time, one day at a time, one step at a time, one success at a time. And yeah, so I would say that is definitely a personal philosophy. So much so that my kids even now are like, "I know, Mom, I know, one bite at a time."
Nice. So, as we wrap this up, if anybody wants to reach out to you, wants to know more about the mobile integrated healthcare profession, how can they reach out to you? If you would leave your LinkedIn website so that they can get in contact with you.
Absolutely. I'll leave it below. And I can send you a link also. I just started the Reinhartz Rundown, which is basically short little videos with disease education, medication facts, super short, 2 to 3 minutes, because we're all crazy busy. So feel free to take a look at the Reinhartz Rundown if that's helpful to you on a regular day-to-day to, get additional exposure to not only that review, but the type of education that I provide to teams. But reach out to me on LinkedIn, connect with me, send me a message. I might take a few days to respond, because I don't like to accept people on LinkedIn without a personal message. I really try to send a quick message to everybody and learn a little bit about people and make a little bit more of a genuine connection. So send me a message, send me a connection. I'd love to chat with you. And I think the same is, if you want to talk about MIH and the associations and getting involved, we'd love to have you. So I'm happy to be a resource.
Nice. All right. So as we end this on Pill Talk Podcast, this episode with Dr. Victoria Reinhartz, great episode, talked a lot about the MIH field. Also wants to let you know that we will have a networking event with Pill Talk Podcast, July 2nd in DC at Capo Lounge or Speak Easy. So make sure you check that out too. So Dr. Reinhartz, Thank you for coming on Pill Talk Podcast. I really appreciate you taking out some of your time today.
Thank you so much for having me. I appreciate all that you do for the pharmacy profession and also advocating and helping people from, other professions and peer professions come on and share what they do. And I just appreciate what you and the Pill Talk podcast do.
Thank you. Well, all right.